Hi there, I am going to be talking to you guys about the Water Swallow Challenge. My name is Samantha Zachary. I am one of the SLPs here at Memorial Hospital. This is Natalie. She's going to be demonstrating how to do the challenge as a patient. Here at Beacon Health System, we use what is called the Yale Protocol. We are going to be changing the name of the ad hoc form that nurses are going to be using. And the new name is going to be a nursing swallow screen. So with the nursing swallow screen, there is a patient population that we are currently using it on. That is anyone from a stroke rule out all the way up to a confirmed stroke, as well as it is going to be started on patients who have been intubated for greater than 24 hours. As long as they've been intubated greater than 24 hours, post-extubation, nursing will do a nursing swallow screen and involves speech if necessary. The deferment criteria includes the patient being unable to remain alert enough for testing. The patient has a history of a modified diet, whether or not be solids or liquids being modified. The patient has an external feeding tube, either through the nose, the stomach, or a J tube. The patient has head of bed restrictions less than 30 degrees. The patient has a tracheostomy tube present, whether it not be a new trach or a chronic old trach. And the patient is NPO by physician order for other medical reasons, such as GI disorders, etc. To start the nursing swallow screen, you are going to sit the patient at 80 to 90 degrees, or as high as the patient can tolerate. You're going to give them 3 ounces of water. This is a volume challenge and the patient must drink all 3 ounces. With that, you are going to administer it either by straw or cup. Natalie said she'd prefer to use a straw. The person administering it can hold the cup, the patient can hold the cup, a family member can hold the cup. The patient has to drink slow and steady with the straw or the side of the cup without stopping. It has to be a consecutive swallow, and if the patient stops for any reason, they automatically fail. So Natalie, I want you to drink this water slow and steady. You can drink it through the straw. Would you like to hold it or would you like me to?
I would like to hold it, please.
Okay. Please drink it slow and steady and do not stop.
Ta-da.
Natalie is now going to demonstrate a failed nursing swallow screen where she is going to have a settle throat clear and take a pause throughout the 3 ounces. So Natalie had a settle throat clear as well as she took a pause throughout her 3 ounces, so that would be considered a fail. Some other symptoms to look for or some signs of aspiration include choking, coughing, the throat clear, loss of water out of the front of their mouth, whether it be drooling or not able to hold the water in their mouth, as well as a wet vocal quality, kind of like they sound like they're drowning, or the loss of voice. So if they're able to communicate with you with a voice and then after the challenge they have no voice, or what we call aphonia, that would be a subtle symptom that they possibly aspirated. So if a patient fails the nursing swallow screen, they are going to remain NPO. The physician needs to be notified, medications need to be changed to either be rectal, IV, or through a feeding tube, and speech therapy needs to be ordered, whether it be for a bedside swallow evaluation or a video fluoroscopic swallow evaluation in radiology. Should a patient fail their nursing swallow screen, it cannot be repeated. Whether or not they move floors or they worsen in their condition, if they fail, it cannot be repeated. However, after 24 hours, if speech therapy has not been involved, at that 24-hour mark, it may be repeated again. Should a patient pass their nursing swallow screen but have a sudden change in condition, a code stroke, a rat call, etc., the nursing swallow screen can be repeated. It should be nurse narrative that there is a change in condition, and the physician should be notified that it was repeated. If a patient passes our nursing swallow screen and they need PO medications, the nursing swallow screen needs to be documented before any PO medications are scanned in and administered. This way they can register and look back that the patient passed the nursing swallow screen and then they receive their medications after safely. Should you have any questions about whether or not your patient is safe to have PO intake, please contact speech therapy and place an order, whether it be a bedside swallow screen or a formal swallow evaluation and radiology. We're more than happy to help assess.